Hello?
Are you ready?
Okay.
No, you can take your time if you need time. No issues because you will
Okay.
minutes in the exam.
Okay. Give me just like one minute if that's okay.
Yes, yes, yes. Start, Doctor Muslim.
Okay. Hello. Good morning. Okay. Good morning to you. My name is Dr. Nasra. I'm one of the children's doctor. How are you, Lily?
Yeah, I'm good, Doctor. Thank you so much.
I've come to speak to you regarding as clinical something that you wanted to talk to me about
Yes,
clinical
yes,
governance.
yes, Doctor.
Yeah.
Clinical governance. So I don't know
Is
anything
there
about the topic. Yeah.
Have you heard about it before?
No, no, Doctor.
Okay. Okay, so just like to tell you first, the clinical governance is usually a framework that has been placed by the pub by the health system in the country, and
Mm-hmm.
it's usually a systematic approach used to maintain and sort of improve the quality of patient care within the facilities. Do you understand?
Yeah, yeah. So they are trying. What I understand is they are trying to improve the quality of care, right?
Yes, we are trying to improve quality of care and making sure that the patient's outcome is good. Okay,
Okay, great.
so
Mm-hmm.
yeah, so basically there are certain measures that are put or elements or
Mm-hmm.
steps in ensuring this. Okay, so they all have to work together to bring this quality of care of a patient. So we have it has 7 elements.
Mm-hmm.
We have education and training. So basically, education and training is making sure that there is continuous education of the staff. Okay. Um, and the education should be updated education, which is evidence-based medicine. Okay. And that will go into improving the care that is offered to the patient. The other element in clinical governance is clinical audit, right? Have you heard about clinical audit before?
Yes, yes. Audit means we need to check if we are not means as compared to standard guidelines, we are not
Yes,
doing good this.
that's very good of you to know that, which is true. So it's basically reviewing the performance and measuring it with the correct guidelines that we have in set and
Mm,
ensuring that this quality of clinical care is offered. So it keeps it keeps on checking what we are doing in the hospital if it's in keeping with the guidelines in the NHS system.
mm-hmm,
Okay.
mm-hmm,
The other element is research and development. So this element always seek in bringing out the evidence based, but
mm-hmm,
not only evidence based on other facilities, but we have local research that helps in our local population. Okay, so it ends up reducing morbidity and mortality. Okay,
mm-hmm,
do you
mm-hmm.
understand up to this point, Lily?
Yeah, yeah. This is very nice. You are explaining very
Oh,
nicely.
okay. So the other element is effectiveness, checking clinical effectiveness. So it's a measure of checking the extent at which a particular intervention works. Okay. So
Mm-hmm,
this measure on it's useful, but these decisions are going to be enhanced by the interventions that we put in. So basically, it will also check the money that we put in. Is it of value, and is the 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 factors that are involved in affecting this will also help in improving the outcome of the
mm-hmm,
patient.
mm-hmm,
Then we have another element which is referred to as openness. Okay,
mm-hmm,
so we need to all the process that happens in our facility, be it a poor practice or poor performance, should not be hidden. Okay, should be done in openness. Okay, we should be willing to give information, correct information. Okay,
mm-hmm.
but ensuring that there is confidentiality when giving this information. Do you understand up to this point,
Yes,
Lily?
yes. Doctor, confidence is very important, right? At the same time.
Yeah. So the other element is information management. So we have patient records which include their demographic, their socioeconomic status, their clinical information. So this element ensures that there is proper collection, there is management of this information and use of it in the healthcare system. And with this, it will determine the system effectiveness, where we are able to detect the common health problems in our facility and in our neighborhood population, okay? So that we can identify, prioritize, and come up with solutions that are applicable for us. Do you understand up to this point, Lily?
Yes, 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 excellent. You are talking very means you are explaining
Oh,
nicely.
so the last element is risk management, okay? So the risk management involves several components. One is it risk to the patients, the other is risk to the practitioners, and then the risk to the organization. So it looks at different elements in terms of how it affects the patient, how it affects us as practitioners, and how it affects the organization. Do you
Yes,
understand up to this point?
yes, yes. I got it. Risk
Okay.
management means we need to minimize the risk, right, for everyone.
Yes, yes, we need to minimize the risk, correct.
Yes,
Okay.
yeah,
So, Lily, do you have any other question apart from
yeah, doctor. Actually, this you said clinical governance, all these points. So who will monitor all these things? Your voice is not good. Network issue. Hello. No, your network is not good. Yes, I cannot hear you. Okay, anyway, you have done, it was almost
okay,
six.
that are responsible in
Yeah, yeah,
can
I
you
can
hear me
hear
now?
you. Yes, now it's okay. Yes, please.
You can hear me? Okay.
Yeah.
So Lily, I would like to summarize what we've
Yes, so
discussed.
doctor, I had one
Um,
question. I had one question. So who
yeah.
will govern all these things, like quality is correct or not, education we are giving or not, right? You said
So
research.
yeah, so that's a very good question, Lily. So each element has its own particular team that are involved, but there's always a combined meetings that has all this in place so that we can see if everything is working in each element. But there's a board that actually checks all these elements.
Uh-huh.
Do you understand?
Yes,
Yeah.
yes, yes, doctor. Thank you so
Mm,
much.
okay. So I'd like to summarize for you, Lily. Is that okay?
Yes, please.
So we've discussed about clinical governance and the 7 elements that are in place and that the importance of it. We've discussed how it's important that we ensure that all these elements work to improve the patient's quality
Mm-hmm. Yes.
of patient care in our facility.
Oh,
Hello?
yeah.
Hello? Hello?
Yeah.
Can
Now,
you hear me now? Yeah.
yeah, now.
Sorry, the network is bad. Yeah,
No, no,
yeah.
no issues.
Okay. Do you
Okay.
hear me now?
Yes,
Yeah.
can hear you.
Okay.
Yeah, so you have summarized, right?
Yes, I think my network got disconnected. I talked a little
Okay.
bit, but yeah.
No issues. Okay,
Yeah.
so your scenario is over now. You did a
Mm.
fantastic job. Your fluency is very good, and I think you are not so bad. But we need to point out some points so that you will be 100% perfect. So,
Okay.
as she previous candidate did same way, you did not check my identity, and you directly said that I'm hello Lily, how are you? Or I'm talking to Lily or something like that, right? So you didn't check my
Yes.
identity. Okay, am I talking to Lily or not? Huh?
Mm.
So you did not check that should be
Mhm.
done. Though I think most of the exam will not deduct your marks for this, but better. Then
Okay.
you started the topic very nicely at 35 to 40 seconds. That are excellent, but you missed the repo. Yeah, like thanks for meeting me today or something like that, right? So repo should have been at least
Okay.
10 seconds, 5 to 10 seconds. You should make a repo for each one statement. Okay. Either you can say, I can see that
Okay.
you are very keen in pediatrics or we keen in clinical governance or in ward work, something like that.
Okay.
So
Okay.
that should have been done. Then you said definition of clinical governance was not correct. You said that we will try to improve the quality of healthcare. That is okay. We do that. But what is clinical governance? This is the framework in which NHS is accountable to the clinical governance team. So what is this? Do you know
Mm-hmm.
understand what is the clinical governance? The governance means you saw in every country there is a governance, right? So they are monitoring every field like finance field or healthcare, everything. The same way in NHS there is a clinical governance team or committee, you can say. That committee is monitoring NHS, right? So for that NHS is accountable to that committee regarding its standards, whether the patient he they are giving they are improving the services or not, they are safeguarding applying this safeguarding or not, then quality of services, eh? Everything, whatever quality of
Mm-hmm.
means I mean employees benefits. So everything is gone. So I will explain you. Before that we will check about what you did in your scenario. Then you say 7 elements. There is no fixed 7 elements. There may be more than 7 also. So you should not say that 7 elements are there. You can say that I will discuss few points, right, regarding this. Then
Okay.
you
Okay.
summarize better what we do in clinical when the medical student is there. We ask him or her to summarize. But here you as a doctor summarizing to him, right? So when it is a junior, he will
Mm.
summarize. If it is a your equal level, means you are ST4, he is also ST4, then either of you can summarize, right? So
Okay. Okay.
remember that. One more thing that you were here in this scenario, you were talking continuously for almost, I could observe that out of 7 minutes, you were talking almost 6 minutes, more than 6 minutes. You were talking. I was talking very less. Means you did
Mm.
not involve me. So what you did, you asked me, do you have
Okay.
any idea regarding clinical? I said no. It means I don't know what is clinical governance, right? But when you said risk management, continuous education, effectiveness, so that time you could have asked me, okay, do you understand what is the risk management, meaning of risk management here in NHS? Do you have an idea what is the continuous education or training? So I will, yeah, I may tell you, right? I know about this. I may not about clinical governance, but I know about what is risk management, research. What is research, right? The person who doesn't know clinical, it doesn't mean that I don't know research, right? So at least when you mentioned seven,
Yes.
seven
Right.
points out of at least you don't ask me every time, but at least 2 or 3 times for 2 or 3 points you could have asked me. So what do you mean or what
Mm-hmm.
do you know about research? Something like honesty. This is very common word, right? Honesty, transparency, openness. You said,
Mm-hmm.
right? So what is the meaning
Mm-hmm.
of that? So I could have told you, right? And then you should appreciate me and go on for the next point. So out of seven
Mm-hmm.
points, 2 points I should have told, and 4 or 5 points you should have told. Correct? So that
Mm-hmm.
will be
I
interactive
got it.
session. Okay,
Yeah.
now I will tell you what is clinical governance. This was all about your scenario. Uh, so clinical governance is the second clinical governance. Here is a committee in different people from the different sectors are there. Suppose we just taking the example, we don't know exactly how many people are there, maybe 5, 7 or 10 people in the committee, clinical governance committee. So one may be doctor, one may be patient, one may be from the finance sector, one may be from the environmental sector, one may be safety engineer. So these people are from different sectors. They are not all doctors or not healthcare professionals, right? So different people from different sectors make a committee, and this committee keep an eye on the NHS. Okay, this is NHS. Okay, so this is NHS, and this is their eye. You can say. So they keep an eye means they are checking whether the NHS is working correctly or not. They are improving or not. They are helping patients in a nice way or not. Right. So there should be some godfather for everyone, right? For example, we have a teacher, we have parents. So this is, you can say, these are the parents of the guardian of the NHS. So keep checking. So this committee is usually changed every maybe elected or something like that. So maybe every, I don't remember when it is changed, or like every year or every 5 years, whatever. But the members are from different state or different sectors. So this is NHS. So NHS is accountable to the clinical governance team or committee. Like, accountable for what? For the patient health care, right? patient healthcare, safety, health improvement, improvement in healthcare standards, right? So these patients who they want best healthcare and international standards should be followed and best healthcare, maybe because there may be new research also, new medicines are coming. So if this trust, NHS trust is not following the latest treatment, then the patient will not be benefited, right? So for example, we got gene therapy in that SMA type 1, right? So if NHS is not uh, updated, right, regarding that gene therapy, then they will not help the SMA patient. So it is the duty of NHS to know the latest treatment regarding SMA and start the gene therapy. That is there. If they are not doing, then this boss is there. This is the boss for NHS. So on what points NHS should improve? Correct. So that 7 points you said. So maybe 7 points, maybe 10 points, 12 points. It is not a fixed point. Right. You said one is risk management. Right. Risk is for both patient and healthcare staff also, because if there is just some risk, for example, COVID, when there was COVID at peak. So risk management, risk for the patient also if we don't give proper treatment, and risk for the healthcare professionals also. Sometimes there may be fire. So fire management is not there. That is also a risk for the patient, and the patient also, patient and healthcare. Then another R was research. So continuous research is also very important, and to follow the research outcome from other institutes, that is also important. Then you said effectiveness. So whatever treatment we give, that should be effective. If it is not effective, then you are wasting the resources. Then education, continuous education of the healthcare staff, doctors, nurses is very important. If we are not updated, then we cannot treat the patients nicely. Then you said openness means honesty and transparency. We should be always be honest and transparent to the patient. Suppose we have done drug error, right? Gentlemen, is double dose was given, then you should come and tell to the parents or the relatives. That is called honesty, right? And transparency same way. Then audit. So regular audit is also very important to improve the standards, right? So when we do audit, we will understand what we are current practices there and what are the standard guidelines now, because guidelines are changing every year, right? And we suppose we are following some guidelines and we are not updated about that. If we don't do audit, then we will not improve. Then IT is also important, information technology, because all the records are kept in software, right? So IT is very important, information technology. So software, right? Hmm. Then patient experience and preferences. So that is EPM, right? Evidence-based medicine. Patient experience. What patient are experiencing in your department? Whatever patients are coming for general pediatrics, then their experience is good or not with your team or with your hospital, with the management plan, treatment plan. Then performance means whether we are doing good performance or not as a healthcare staff. So all these points are included. When we improve in all these points, then NHS will improve. So that's why NHS is accountable. This word is very important. This NHS is accountable to the clinical governance team for all these points. So this is called clinical governance. Right? Governance means someone is governing. So this team is governing to the NHS. Am I clear till now in this topic? Clinical
Yes,
governance.
yes,
So now
yes,
you will not
very
forget.
clear.
Okay.
No, I will not forget.
Yes.
Very clear.
Yeah, welcome. So next we will go for the EBM evidence. I will just, yeah, recording will be there, don't worry. Uh, she was one more topic was there. That is last topic is EBM, evidence-based medicine. So I will explain you what is. First of all, you remember whenever you talk to the medical student or the patient, you should involve them equally, or at least 40% time they should talk. So EBM is evidence-based medicine. So one, I give you the example. Whatever medicine or whatever procedure, whatever surgery I'm doing. So for example, medicine means everything like procedure, hmm, surgery or medicines. So whatever medicine I'm going to the patient, that should be evidence-based. Suppose I am a doctor. First time I have started sitting in the outpatient department, first time, right? So first time you are sitting in the outpatient department and one patient came to you regarding, uh, for example, they have come for community acquired pneumonia, for example, community acquired pneumonia. Okay, first time you are seeing the patient. Now you will give what you will give medicine, which medicine you will give to this patient. Suppose he is 2 years old. So what medicine you will give? Yes,
Coamoxicillin.
yes, no, amoxicillin only, right? Amoxicillin you will give for the community acquired pneumonia. So how you understood this amoxicillin? Because this is your very first patient, right? So you don't have any experience, correct? Here, suppose you have experience, then also it will be counted. So amoxicillin from where you got? You from the evidence based, means evidence from where? You got from the Cochrane reviews, you got from the NICE guidelines, because you during residency you were reading NICE guidelines, you were seeing the Cochrane reviews, then you got experience in the ward also when you were working under the consultant, so you got your previous experience. So these are the evidences from where you got to know. Please mute yourself, this is very difficult for me. My rule is I will remove the person if you do not mute me. So you got the evidence from your experience, NICE guidelines, Cochrane review, etc. Then from this evidence, you are giving this amoxicillin to this person, right? So this is called evidence-based medicine. Without any evidence, you cannot give anything to any person, any patient blindly. So this is called evidence-based. Now, what are the steps of evidence-based medicine? I tell you. So first of all, a patient has come to you. You have the diagnosis. You just do the physical examination of the patient, right? Physical examination and take the history. Correct. This we do every day. First history and physical examination. Then you made a provisional diagnosis, right? Then what is provisional diagnosis, suppose? Then what you do? You do, if you are not confirmed about a diagnosis, then you do investigations, right? So whatever investigation you want to do, and then you got the confirmed diagnosis. So once your confirmed diagnosis there, what we do? You go and search what is the best treatment for this diagnosis. Correct. So you find that two treatments are equally good for this disease, for the condition, for any condition. Suppose two medicines are equally effective, or maybe one medicine, one medical treatment and one non-medical treatment. Like for example, there is a physiotherapy, or this is a medicine. Both are equally effective for particular patient or particular disease. Now what will do? You will both are almost equally effective. Then you go to the patient and you tell this to the patient, "Okay, I have got two best treatment for you for this condition." Now patient will prefer which treatment to take according to his belief, according to his religion, according to his experience. So this is called patient preparedness. So patient will choose because both are equally good treatment, almost good treatment. So then suppose he said, no, no, this is not good for maybe my previous experience is not good and I have a good experience with this. So I want to go for this one number. So this is called patient preparedness. So this is called a triad. Hmm? Usually triad, in which you will see EBM, evidence-based medicine, in which you will diagnosis you should know. Then you will find out that what is the best treatment for this, and then patient preparedness. So this is called evidence-based medicine. You got what is EBM? If you know this concept, then it is very easy for you to tell to the role player regarding EBM. When you talk about EBM, you should know about the pyramid also, right? So because best evidence from where you got, when you got best evidence here, best evidence from where you got, because best evidence from the top of this, right? So when we start this research for the treatment or standard guidelines, when we get these standard guidelines here, so here we start animal studies, then case studies, then case control studies, then cohort studies, random control trials, and then systemic reviews, then guidelines or something like that, right? So you should know this pyramid, and as we go up, we got the best treatment. Narrow down the things. So this you need not to explain all the points, but 3-4 points you can tell, and then like Smith meta-analysis, systematic review meta-analysis, and then the guideline. So what is the top? Top is the best thing, right? So that we use here for the patient, because we cannot do trial for each and every patient, each and every condition, right? That's why guidelines are there, because other doctors have done research on this same condition, of various patients of the same condition, and then they got the best treatment like this. So this is called evidence-based medicine. Am I clear till means this is clear to you? What is EBM?
Yes.
Hmm? Okay. So I give another example in adults, right? Very good example which I always remember. Suppose a patient has low backache. Hmm? Suppose this is an adolescent or adult patient, low backache. Okay, so he has come to you to see. So what you do to do history, take physically do physical examination, then you do MRI of the spine, then you whatever diagnosis if our disc prolapse is there, right? Disc prolapse you found on the MRI and on a physical examination. Now you go for the standard guidelines, many nice guidelines or other guidelines, like Cochrane review. Then you found through those guidelines that this is either physiotherapy or surgery. For this condition is equally good. If he patient will do good physiotherapy, intensive physiotherapy, then we might need not no need of surgery, suppose, or equally effective. Then you will give this preference to the patient. So patient will prefer either physiotherapy or surgery. It is his choice, but they both should be equally effective. So this is another example where you will see evidence-based medicine and preference to Dr. Danya. Even okay, so this is all about the EBM and audit and all. So, friends, actually, I'm finishing this current batch of communication course. Maybe tomorrow will be last day. So from Monday, I'm starting another batch, new batch. So if any one of you are interested, then you can ping me. So you can join my course. So 2 seats are still there. If you want to join, this course will be around 2 months, and we will do almost 70 to 80 scenarios. And I will send in the group whatever feedback I have from the existing batch students. So that is another thing is full clinical course also we are going to conduct. So I got few candidates, and still if someone is interested, then you can join the full course also, full clinic, in which everything will be covered, like clinical stations, communication, video development. So that will run around 4 months, maybe around 3 to 4 months, and this communication for 2 months. So you can contact me on my number, and you can join today also. So we will start from Monday. So thank you all for joining today. I will share the recordings in the group, upload on the YouTube, and will share. Thank you for joining today. If you have any question, you can ask me in the WhatsApp group. Thank you all. Any question?
Thank you so much, sir. But if these scenarios come in exam and we forget any point, any of the
No,
like
no, no,
6
not
or
no, not to worry. Not all steps are fixed. So it is art. You should have the art that is skip one point and mention everything else, right? Involve the candidate. That is very important. So don't bother that you are, but minimum